Hi, I'm Mira from Flow with Mira. This is a Pilates class for back pain relief. We are going to stretch the muscles and strengthen the muscles to improve your back pain. However, this class is not suitable if you have osteoporosis. What we need for this class is a massage ball. If you have a tennis ball or a golf ball, you can also use a weight as well, any weight, 1 kilo, 2, or whatever is available to you. And we will also need a scarf or a long towel to help you to stretch. Okay, so we're going to begin the class with some foot relief. So let's put the scarf away. You can either use a massage ball or a weight, an arm weight. So let's place any of those on the floor. I'm going to give you an exact example for the two of them. So let's see with the massage ball. I'd like you to just bring the ball of the feet over the ball. So maybe medially in the middle. And then from there, I just want you to put a weight on it and then push your weight through, massage through and roll the ball towards the heel side, like as though you're wearing a high heel shoe. And then reverse that motion back towards the front of your foot. And you can do the same with the arm weight. It's the same thing. Place the ball of your feet over it and then just go through the sole of your foot towards the heels. And keep working with that motion. You can also work, I'm going to go with the massage ball again. You can work towards the inside of the foot, massage through the inside of the arch and the middle of the foot, the middle side, and or the outside of the foot. Just walk through all the arches of your foot. Work on one foot first. And you can also put a little bit of weight, transfer your weight on it so you pressurize the foot a little bit more and to get a deeper release. Whatever's suitable for you. And then do a few rounds. Walk through the tender part, say. Mine will be more on the back, sort of towards the outside. The inside of my foot. I'm going to work through it. Okay. You can also do whatever direction, circular motion, forward, diagonal, anything that feels good for you. All right, and just let that go for a moment. And I want you to just feel your foot. Okay, so feel the sensation on the work side. How does it feel? Okay, so what I'm feeling for me is I'm feeling quite a lot lighter. And I feel this energy of my arch lifting up towards my pelvis. And that will help me to connect my pelvic floor better and create a bit more stability. All right, so pretty good on my right side. I'm going to work on my left side too. So let's do my left side with here. I mean, you can choose one item. So I'm just going through different to show you an example here. So over the sole of my foot, whoa, very tender on my left side. Okay, and so I'm thinking the reason why I'm feeling tender on my left side is because I have sprained my left ankle numerous times. And so my left foot is a little weaker compared to my right. And my arch, I suppose, is not as strong as my right arch. So just observe how your foot is feeling today. You can roll to the inside of the arch, the middle of the arch, and the outside of the arch. You can do a circular motion. And again, you can transfer your weight onto that foot, right? For a deeper sort of fascia stretch here. And let it go and do a few more seconds on it. So really, really good or great sort of simple exercise to alleviate pain around your ankle, around your feet, to actually invite a sense of sort of lift through the pelvic floor. Okay, strengthen the medial line of the body. Okay, and we'll just finish on that left foot and then have a feel. Little prance, walk on the spot. How do you feel in the feet today? Observe, keep it to yourself, and just listen to your body. okay? All right, so we're done with the feet. Let's put that aside. Now, what we're going to do now, I want to activate your inner thigh. So what we're going to do, use the, don't run away, ball. Right, use the side of your hand. I want you to slide through the inner thigh, the adductors here. So I want you to go, just slice it up. Just rub up and down, just rubbing, stimulating the inner thigh, which will then help you to stimulate your pelvic floor and the core better. But obviously, try and make sure that you don't round your back too much. Hold your back and slice away, okay? Making sure that you're not really flexing your back. That's gonna hurt your back even more. So if you really need to, you can go on one leg and slice it this way. This is probably a better position if you have an acute back pain. And you can go to the other side. There we go. Okay. And just let it go and then have a feel again. How do you feel? How do you feel with the stance? Okay. Have your feet parallel and then just stand still for a moment. Close your eyes if you need to. Observe your feet. Observe your legs. Observe how they talk to your pelvis and how they talk to your whole posture. All right, and let it go. Okay, all right, so have your scarf somewhere nearby you. Okay, let's go ahead to lying on your back. We are going to stretch our glute first. So lie on the back, bending the left knee, taking the right leg up, dorsiflex the foot, bring the right leg across this way, and then grab the back of your left thigh and pull the left thigh towards you. Now at the same time, I want you to use your right elbow to push your right thigh away from your chest and pulling your left thigh to you, pushing the right thigh away. And see if we can have your pelvis grounding or grounded to the floor. And we stay here. So we're stretching the right glute muscles. We're in breath. Allow, as you exhale, allow the body to settle, to relax down to the ground. As you inhale, push the thigh a little bit more, deepen the stretch. Exhale. 2 more breaths. Inhale. Exhale. Last one. In breath. And exhale. And let that go. Release. Switch over to the other side. Put my left leg across, dorsiflex my left foot, grabbing the back of my right thigh, pull the thigh to my chest, and use my left elbow to push my left thigh away. So in breath. Exhale, allow the body to release or relax down to the floor. Again, inhale, deepen the stretch by pushing the left elbow against the left thigh and pulling the right thigh to your chest. In breath. Exhale. 2 more breaths here. Inhale. Last one. Okay, and let that go. All right, have your feet as wide as your mat, so wider than your pelvis. Have your arms up to a T position. Moving on to our hip rolls here. We're going to drop the legs to the right side. So allow the lower body to twist and pulling the center back, return the legs and drop the legs to the left and using the center, return the legs. Again, to the right with twist. Exhale. If you feel discomfort at any range, I'd like you to refrain yourself from going too far and just reduce the range of motion. Remember, take care while practicing today. Listen to your body. If anything doesn't feel comfortable, pull back from it. In breath. Exhale. 2 more sets. In breath. Exhale. Center. Inhale. Switch your center on. Bring the legs back to center. One more each side. In breath. Exhale. Last one here. Inhale. Exhale. Center. Okay. Walk your feet back to a parallel position. Now, taking your arms along by the side, let's move on to our pelvic rocks here. Open the front across the front of the chest here. Take an in breath. Your pelvis is in neutral position. As we exhale, allow you to recruit the abdominal muscles and then use the abdominal muscle to imprint your lower spine. So your pelvis will tilt, what we call posteriorly. So curling the bottom up and then release down. Exhale, deepen using the abdominal. I want to see a little hollowing sensation across the front of your abs and then the lower back imprinting. So stretching the lower back and the bottom will come off the floor and then release back. Now, if this motion is still feel uncomfortable for you, you can reduce the range of the rocking. If that still feel uncomfortable for you, I'd like you to not rock at all, but just work on the abdominal engagement and let go. So you can either follow me through and rock and go into a deep flexion as much as you can and then release, or you can reduce the motion, the range of motion and still rock, or you can not rock at all, just engage your TVA muscle, your deep abdominal muscle, and just let it go. Okay, I'd like you to choose a movement that suits your back today. Let's do 2 more times here together. Exhale. Inhale, release. Last one, exhale. Inhale, release. Now we're going to take it through your pelvic curl. Exhale. If you can, rock the pelvis just fine. Continue the journey. Press the arms, use the hamstrings to help you to lift the pelvis to a height that feels comfortable for you. The abdominal muscle is still drawing in towards the spine. In breath at the top. Exhale, deeper engagement of the abdominal to flex the spine down, vertebra by vertebra, down to the floor. If you don't feel comfortable with that flexion, I'd like you to recruit the abdominal and press up straight away without any articulation. Inhale at the top, and then as you exhale, fold through the hip and then release back. So no articulation at all. So you have 2 choices, pelvic through articulation or a bridge hip lift without any articulation. Again, I'd like you to choose an exercise that suits your lower back today. In breath. Exhale, roll it down. So I'm going to do the articulation, pelvic curl with articulation today. Exhale, scooping in or rolling up to the bridge. Inhale. Exhale, rolling down, vertebrae by vertebrae, and release back to neutral. Last one here. Exhale, deep scoop in the abs and curling the pelvis. Take it all the way up to your bridging. Making sure your inner thighs are working, pressing the big toes down, spreading your toes on the floor. Don't forget to lift the arch of your feet. Exhale to roll the spine back and release back to neutral. Excellent. Now I'd like you to straighten the left leg down on the floor. Grab your right leg on the shin, on the knee. Press your right thigh to your chest. Dorsiflex your left foot. So we're going to do a little hip compression here. Exhale, we're going to press your right thigh to your chest. Keep reaching the heel, the left heel away from your hip and release. 2 more times. Exhale, we press and reach the heel and inhale, release. Last one, exhale, press the thigh to your chest, reach the left heel and release. Let that go. Bend the left knee. Take the left foot in. Extend the right leg. And go ahead. Take the left leg up. And compress the thigh, the left thigh to your chest. Dorsiflex your right heel or your right ankle. compressing as you breathe out and let it go. Again, pressing, 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 and let it go. Last one, compressing the hip, reaching the heel away in opposite direction, and let it go. Okay, release the foot down. Take the right foot in, go back to the neutral pelvis, arms long by the side. Now moving on to our leg lift here. So ideally, I like you to have your pelvis in neutral positioned. However, it may not feel good for some of you. So if that pelvis position doesn't feel quite right, you can go ahead and scoop the belly in and imprint the lower spine down to the floor so your lower back is lengthened, okay? So let's go. I'm going to go with the left leg first. As I breathe out, and then draw my abdominal in, stabilize the pelvis so I'm not jolting my belly out or jolting my lower back up. And I'm going to take my left leg to a tabletop, knee over your hip, and the shins parallel to the ground. And I'm going to lower down as I inhale from my hip joint. Exhale. Inhale. Exhale. I'm trying to keep my pelvis in neutral. Exhale. However, like I said before, if neutral pelvis doesn't feel comfortable for you, I'd like you to deepen the abs a little bit more and tuck the pelvis up and imprint the lower back. And move the leg in the posterior tilt position. But make sure you are still recruiting your abdominal as you take the leg up. That you're not jolting the belly out as you lower the leg and then rocking back again. So stability in the position of the pelvis in whatever position you prefer today. Neutral or posterior tilt. I'm going to go back to neutral and let's hold that. Now same thing again, extend the left leg forward and then pull in. Inhale, scoop deep, stretch the leg. Exhale. Again, you can do this in posterior tilt or staying in neutral. Extend and so listen to your body, observe, and find a position that suits your back today. And pull in, whatever position that is, maintain that position. Keep the intra-abdominal pressure as you move the leg away and in. Okay, and lower the leg down. Let's go over to the other side. Stabilize the pelvis, breathe out, take the leg up to tabletop. We extend, we're gonna do leg lift first. Oop, I'm jumping hoops, sorry everybody. We go lower down as you inhale. Exhale, up, lower down, tap. Exhale, up, lower down, tap. Exhale, up. Again, stabilize the pelvis, stay in neutral or posterior tilt. Either position that feels more comfortable for your back today. I can't tell it for you. You need to listen to your body. My back feels good in neutral positions. I'm keeping it in neutral today. All right, one more time here. Inhale down and then up. All right, single leg stretch. Extend, in breath. Exhale, deep scoop. Inhale, reach. Exhale, deep scoop. Inhale, extend, reach. Exhale. Again, hold your center. Your abdominal should be contained in towards the spine as you extend the leg and as you pull it in. One more time, please. Extend out and pull in. Lower the foot down. Brilliant. Okay, now I'd like you to grab your scarf. Bring the right leg up. Place the scarf around the foot here. Straighten the leg. Try to ground the pelvis down and hold on to the scarf or the towel on the end. Now, you can have your leg in a bent knee position or straighten. Right. Choose one that's suitable for you today. Let's do some leg circle here. So dorsiflex the foot, stabilize the pelvis. Bring the leg across the body, down and away. We exhale one round, stay parallel. Inhale one round. Exhale one round. Inhale one round. And then keep the pelvis stable and moving through the hip joint. And one more this direction, and then exhale. And now reverse. We go out, around, in. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Last set. Inhale. Exhale. And stay. Hold. Now, let's move on to a hamstring stretch. So place the scarf around the ball of the feet. So you can really try to bring your ankle into a deep dorsiflexion here. Now pull the leg as far as you can for a really good hamstring stretch here. All right, now that you find it, hold that position here. Now I'd like you to release the ankle, point, and then bring it to dorsiflexion again. So point, and then bring it to dorsiflexion. So we go plantar flex the ankle, and then dorsiflex the ankle. Plantar flex the ankle, dorsiflex the ankle. 2 more. And last one. And okay, bend the knee and release that. Lower the foot down. Change, extend the right leg, bring the left one up. We start with some leg circle. Okay, vertical leg. You can also bend the right knee if that suits you better today. All right, let's go to leg circle. We go across the body, stay in parallel, and then away. And then exhale, and then in-breath. Exhale, in-breath. Exhale, in-breath. Exhale, in-breath. Last set, or last one here, and center hold. Reverse out. Exhale, in-breath. Exhale, in-breath. Exhale. Last set. Exhale, center hold. Let's go to the hamstring stretch. So place the scarf around the ball of the foot and deep dorsiflex and pull the leg closer to your chest. And find that. After you find that, and we're going to plantar flex the ankle and dorsiflex. Plantar flex and dorsiflex. Again, plantar flex and dorsiflex, and plantar flex and dorsiflex. 2 more, and last one, and pulling in, pulling in, pulling in, and let that go. Well done. Put the scarf onto the side for a moment. Bring the legs together. Open your arms out to a T position here. Let's go spine to supine, rotating from the waistline. As we inhale, we keep the legs together. Exhale through the center, pull back. Inhale over to the other side. Exhale, pull to center. Now really want your legs to travel together. So as I go to my right, my left foot come off. As I go to my left, my right foot comes off. Exhale, center. One more each side. Inhale, twist. Exhale. Last one. Inhale, twist. Exhale. Well done. All right, bring your arms down to the side. Let's do some leg changes. Now, if you had your pelvis in posterior tilt before when you do the leg lift, most probably you will feel more comfortable with the pelvis in posterior tilt when you do the leg changes. So we go. Exhale as you take the right leg up to tabletop. Now, as you breathe out, stabilize your center. Let's switch. And switch. And switch. Switch. Again, you can tuck the bottom up and imprint the lower back here to do the leg changes. And 2 more sets. Last set. Last one. Bring both legs up to the tabletop with stay. Place your hands, the palms of your hands, against your thigh. Then we're going to do some TVA squeeze here. So I'd like you to think about pushing your thigh up, at the same time pressing down with the palm. So here we go. As we breathe out, we push up. As you push down, hold the center tight for 5, 4, 3, 2, 1, and release. 3 more times. Exhale, pull in the center, push up and push down. 5, 4, 3, 2, 1, and release. 1 more time, please. Exhale, press up and push down. 5, 4, 3, 2, 1, and release. Well done. Lower the foot down, and second one down. Turn around, face me. Let's do some let's do some chest opener. So stack the legs together, interlacing the hands behind your head. I'd like you to have your feet together and align your feet with the spine. Okay, lifting the underneath waist, please. From here, we inhale as we open the chest. Rotate yourself towards the back. Exhale, we close. Let's do 3 more times. Inhale. As we open. Exhale. And 2 more. Inhale. Exhale. Last one. In breath. Exhale. Well done. Okay, now I'd like you to release the bottom arm long. All right, now have your legs stacked up the same way. Engage your underneath waistline. You can have the top hand here. Let's move on to our clamps. We open the thigh and we close for 10. 2 here. Stabilize the pelvis. 3 and 4 and 5, 6. Making sure the pelvis doesn't rock. 7, 8, 2 more. 9. Last one. 10. Okay, now take your feet forward. So you're creating like a letter H here. Now lift the top leg up. Hover there. Stay for 10, 9, 8. Lift the underneath waist off. 5, 4, 3, 2, 1. Hold that. Let's do some circle. We're going to go down with the thigh, up with the thigh, and then forward. And 2. So circling around the hip joint or in the hip joint. And 3. And 4. And 5. Pelvis is stable. 6, 7, 8, 9, and 10. Let's reverse. Take it up, down, and forward. And then up, back, down, and forward. 3, 4, 5. I know you're feeling slightly burned in the pelvis. 4. And 7, 8, 9, 10, and finish. A bit of hammer in the bottom. Well done. Help yourself up, please. And then lift the underneath arm, reach up to the sky, and side bend over. And let it go. Let's go over to the other side. So we start with the chest opener. Stack the legs together. Feet aligned with the spine. Interlace the hands behind your head. As we inhale, we open through the chest and we rotate back. As we exhale, we close. Again, we inhale, rotate. Exhale, we close. Don't forget to lift the waist up. In breath. Exhale. One last one here. Inhale, rotate. Exhale. We close. Well done. Okay. Extend the underneath arm. Hands on the hips. Moving to our clamps. We open. We close. And 2. We close. Stabilize the pelvis. 3. And close. 4. 5. 6. 7. 8. 2 more, 9. Last one, 10. All right, take your feet forward, create a letter H with the leg here and hover the top leg. Hold it there. Stabilize the center, lift the underneath waistline, stay for 10. 9, 8, 7, 6, 5, 4, 3, 2, 1. Hang on there. Let's do circle. Down, up, forward, 2, up, 4, 3, up, and 4, up, and 5, and 6, and 7, and 8, and 9. Last one, 10. Reverse. We take it up, back and down, and 2, and 3, and 4. Stabilize the pelvis. 5, and 6, and 7, and 8. Almost there. And 9, and 10. Okay, and let it go. A little hammer on the bottom. Well done. All right, and let's help yourself up. We come up, lift the underneath arm, reach up to the sky, and side bend. Just a quick one. And let it go. Okay, let's go to all 4 position or quadruped position. Align the shoulder and the heel of your palm. Align the knee and the center of your hip. So push the floor away. Lift up and engage the abdominal muscle so you are not swaying down like a hammock here. Opening across the front of the chest. Let's move on to our cat stretch. We round the spine. So a little different here. I want it to go into flexion. Now, hold the flexion. Send the pelvis to the heels. And bring the body over your hands and knees again. Through neutral, extend the upper back into extension. Again, through neutral, into flexion. And sit the pelvis back again. If this feels very uncomfortable for you to be in flexion, please just stay in a normal cat or remove the flexion altogether. Okay? So we're going to sit back here and then bring it back over. Hands and knees through neutral. Upper back extend and arch. And rounding back, flexion, sit back if that feels comfortable for you. If not, you can emit that. And then through neutral, and then extend the upper back. And last one, rounding, sitting back, and then over your hands and knees, through neutral, and upper back. And release. Well done. Let's move on to our thread and needle stretch. Take the right arm up to the sky. To the side, that is. Bring your arm through underneath the left armpit. Rotate your body and reach the arm across to the opposite side. Now your pelvis should ideally be above the knee still. Now, lower the shoulders and the head down. If you feel comfortable here, you can extend the left arm forward. If not, you can keep the left arm just by the side of your face. And stay here for 5, 4, 3, 2, 1. Release the arm back. Push off the floor. And go back to your quadruped. Other side, left arm out to the side. And underneath through the armpit, rotate the body across to the other side. And then if you feel comfortable, lower the shoulder and the head down. And you can also extend the right arm overhead. Make sure the pelvis stays right over the knee, please. And you're not flopping or swaying down towards the right. Stay here for 5, 4, 3, 2, 1. And right arm back to next to your face. Push the floor away. Quadruped. And let that go. Let's transfer yourself down to the floor. Okay, almost done here. All right, so basic back extension here. So your legs are long behind you.
parallel position. Your arms are long by the side here. Now really want you to lift the abdominal wall up and lengthen the lower spine. The moment you flop that belly down, you're going to compress more on the lower spine here, which may not feel comfortable for some of you. Okay, so drawing up the abdominal, send the sitting bone down to your feet, arms long by the side. Neck is long. From here, we're going to inhale. We glide the shoulder blades down without dropping in the lower spine. You take the upper back and the middle back to your maximum extension, keeping the neck long. Exhale, you go down again. Inhale, energy through the legs and the abdominal. Gliding the shoulder blades, lifting upper back, middle back, and coming down. Again, inhale. So we are strengthening our upper middle back here. And come down. 2 more times. Inhale, reach long. Exhale. One last one here. We're going to stand that position. Inhale, reach, stay. Turn the palms facing down to the floor. Open your arms out to a T position, palms down. Now opening across the front of the chest, hold the upper back, slide your arms down to the side like an aeroplane. And out. Exhale, pull down. Inhale to the T. Exhale, pull down. Inhale to a T. Exhale. In breath. Exhale. In breath. Exhale. In breath. 2 more. Exhale. In breath. Last one. Exhale. In breath. And then bring arms back next to your side. And then release the body down. Bring the forearm to the side of your shoulder. Use the abdominal, pull off the floor and push away. And sit the pelvis down to your rest position. And you can sway your pelvis left and right. Relaxing, releasing the back muscle. And then just keep breathing here. Inhale. Exhale. One more. Inhale. Exhale. And come to a stillness and go ahead and roll the spine up to a seated position. Nice and tall. Well done. Thank you for joining today. I wish you a lovely day and I hope to see you in my other class. Have a great day. Congratulations on completing the class. Well done. I'm Mira and I'm here to help you to look and feel your absolute best through Pilates. If you enjoyed this video, you will love my free Better Postures in 5 Days program. Click the first link in the comments and sign up. I will instantly send you a daily email with a 15 to 20 minute workout each day. This workout will work your whole body to help open, stretch, and strengthen your posture. Your spine and body will love you. Don't forget to like and comment with any question you may have about Pilates. Subscribe and turn on notification so you don't miss any of my free Pilates video. See you in the next class.